Our research is important to spread awareness about heart diseases, how to cure them, and how different factors affect the likelihood of having a heart disease.
Guys, Google me ASAP. There's an emergency.
Hello? What?
Magandang umaga! Kami ang pangkat ni Moreno, Bundal at Jimenez. Tatalakayin namin ngayon kung bakit mahalaga ang research na ito at ano nga ba ang nilalaman nito. The content and objectives of this research includes the introduction and purpose, the analysis of each variable with histogram, the bar graph for the categories of the variable BMI, comparing the LDL cholesterol levels of different BMI categories, and of course, the summary of data.
This research aims to analyze, predict, determine whether a patient may have heart disease. Heart conditions often remain unclear until symptoms appear, making early detection crucial. Conducted by the National Heart, Lung, and Blood Institute in the United States, the study explores potential lifestyle factors contributing to the development of heart disease, offering valuable insights for prevention and management. In short, as Star said previously, we want to spread awareness. Analyzing the data can lead to predicting, and this helps us foresee the possible diseases that can move to life in a quick span of time.
The histogram shows the cholesterol levels of patients who consulted cardiologists. The distribution is fairly symmetrical, with the highest density in the 90 to 110 range, containing the most patients. Cholesterol values at the lower end and higher end are less common. Overall, the cholesterol levels are evenly distributed with no significant outliers or extreme values, and no strong skewness in the data.
Next is the distribution of the BMI. The distribution among patients who consulted cardiologists is relatively even, with the highest density in the normal BMI range from 20 to 25. Fewer patients fall at the extremes, with lower occurrences of BMI values between 10 to 15 and 45 to 50. No significant outliers are present, and the broad spread reflects a diverse population, though the distribution remains consistent across most BMI categories.
Next is mental health. This data is spread evenly across 0 to 30 days, with minor fluctuations and no extreme clustering. The highest density occurs between 15 to 25 days, indicating many patients reported good mental health for this duration. The lowest values are near the extremes, particularly around 0 to 5 days and 30 plus days, showing fewer patients in these ranges. Overall, the most common period for good mental health is 15 to 25 days.
The graph indicates fairly symmetrical data and peaks from 7.5 to 10 hours, which is a good amount of sleep. However, the lowest values are at the extremes, around 2.5 to 5 hours and 10 to 12.5 hours, with fewer patients reporting these sleep durations.
Next is the age. The ages of respondents vary from 20 to 85 years old, showing that ages 20 and above are the more likely or more aware of developing heart diseases. The data is evenly spread, with common ages being 25 to 40 and 50 to 60 years. The lowest density are seen near the extremes, particularly below 25 and above 75 years. With fewer respondents in these ranges, the data is still relatively symmetrical, showing no clear skew.
And next is the bar graph for the categories of variable BMI. The bar graph shows that people who have a BMI over 30 or are obese um, and are much likely to consult cardiologists. Meanwhile, people who have BMI less than 30 are less likely to consult one. It suggests that obese people are more prone to heart disease compared to people who are overweight, have a normal BMI, or are underweight.
Lastly, based on the box plot, the median cholesterol levels are similar across all BMI categories, with no significant differences. The variability shows no significant increase or decrease, with changes in BMI based on its interquartile range. The range of cholesterol levels, as shown by the whiskers, is relatively similar. There are no significant outliers that can be seen in any BMI category. There is no strong trend between cholesterol levels and BMI categories, and all groups display similar cholesterol distributions. This suggests that BMI does not appear to have a significant influence on cholesterol levels based on the data.
In conclusion, our analysis demonstrates that various factors can influence the likelihood of developing heart disease. The data reveals the complex interplay between these factors, highlighting their role in shaping individual health outcomes. We also observe a notable behavioral pattern. Individuals who consulted cardiologists appeared to have increased awareness and concern about their heart health. This trend was particularly evident in the age distribution, as depicted in the histogram, which showed that individuals in certain age groups were more likely to seek medical consultation. This finding suggests that age and heightened awareness, possibly driven by symptoms or preventative concerns, play a significant role in prompting individuals to consult with cardiologists. The overall results emphasize the importance of early detection and awareness in managing heart disease risk, underscoring the need for targeted interventions based on individual risk factors.
Thank you, Carla and Star. That is the end of our presentation. Thank you, Ma'am Hannah, for listening. Bye!